Hi, I'm Monica. I have asthma. I'm going for a run. Come join me.
Somebody call 911.
Asthma is a multifactorial disease influenced by genetic, environmental, occupational, lifestyle, and immunological factors. Genetics play a significant role in asthma. If a family member has this condition, the likelihood of developing it is higher. Specific genes are linked to increased sensitivity of the airways. Environmental factors are key triggers. These include allergens like pollen, dust mites, pet dander, and irritants like tobacco smoke, pollution, and strong odors. Weather changes can also trigger symptoms. Respiratory infections, particularly in childhood, can contribute to developing asthma. Viral infections like common cold or flu can inflame and sensitize the airways, leading to asthmatic reaction. Occupational asthma is triggered by inhaling fumes, gases, dust, or other harmful substances at work. Industries like woodworking, farming, and manufacturing have higher incidences of asthma cases. Lifestyle factors such as obesity, lack of exercise, and smoking can exacerbate asthma. A healthy lifestyle may help reduce the severity of symptoms. The immune system's overreaction to harmless substances can lead to asthma. This hyperactivity of the immune response is a central feature of the development of the disease, especially in allergic asthma. Emotional stress and psychological factors can also trigger asthma symptoms. Stress can lead to physical responses in the body, which exacerbate asthma. Asthma symptoms can vary widely among individuals and can fluctuate in severity over time. They may appear suddenly or develop gradually, and their intensity can range from mild to life-threatening. The most common symptoms of asthma include shortness of breath, wheezing, chest tightness, and coughing, particularly at night or early in the morning. Wheezing is often the hallmark of asthma, noticed especially during exhalation. Breathlessness can occur during physical activity or even at rest in severe cases. Asthma exacerbations or attacks are acute episodes where symptoms suddenly worsen. It can be triggered by multiple factors that were previously mentioned. Exercise-induced bronchoconstriction is common in asthma patients. Symptoms like coughing, wheezing, and shortness of breath are triggered by physical exertion, much like Monica.
Let's talk about the pathophysiology of asthma. It begins with the exposure to respiratory irritants or allergens, such as pollen or tobacco smoke. This activates the immune response, in which interleukins and immunoglobulin E is released. Subsequently, the degranulation of mast cells continues the cascade of events leading to the inflammatory response. The release of histamine, cytokines, leukotrienes, and prostaglandins lead to increased capillary permeability, followed by bronchoconstriction, increased mucus secretion, mucosal edema, impaired function of pulmonary cilia, and airway remodeling. The outcome being obstruction of airways, which is manifested by dyspnea, wheezing, and cough.
Hi Monica, my name is Nurse Kay. The doctor ordered some medication to help you breathe better, and once we stabilize you, we can talk about some of the diagnostic tests after. Thank you for your patience.
There are various medication classes used in asthma management. Primarily, there are the bronchodilators. These include short-acting beta-2 agonists, or SABAs, such as albuterol. SABAs are often referred to as rescue medications as they are used in acute asthma exacerbations. Long-acting beta-2 agonists, aka LABAs, such as salmeterol, are also used for asthma. This medication can be used as maintenance for better asthma control. Another class of medications under bronchodilators are anticholinergic agents, which can be short-acting, like the medication ipratropium, or long-acting, like tiotropium. The methylxanthine medication, theophylline, is a bronchodilator reserved as an add-on treatment for patients with moderate to severe asthma who are not controlled using LABAs or inhaled corticosteroids. Inhaled corticosteroids are considered a cornerstone of asthma therapy. These include fluticasone and budesonide. Other medication classes used for asthma treatment include leukotriene receptor agonists, such as montelukast, and mast cell stabilizers, such as cromolyn sodium.
I'm going to talk about some of the diagnostic procedures that can be done to confirm asthma diagnosis. Pulmonary function tests are a series of different breathing tests usually done at the hospital or clinic. It measures your breathing to help the provider diagnose or monitor asthma. The most common one is called the spirometry. This test measures the volume of air the patient inhales and exhales. The test begins with full inhalation and forced expiration of air from the lungs. To perform this test, the patient must inhale maximally to total lung capacity without any interruption, then exhale air into a tube connected to the spirometer as rapidly and completely with maximum effort. Forced exhalation must go on for at least 6 seconds and 3 seconds in children. Another common test is the peak expiratory flow rate. A peak flow meter is a handheld device that measures how well the air moves out of your lungs. During an asthma attack, the airways often narrow. The test is done with the patient either in standing or in sitting position. The patient will have to take deep, full breaths. Then the patient will forcefully exhale into the mouthpiece of the device, and the peak flow measurement is measured in peak flow zones.
Knock, knock. Hi, Monica. I'm Kara. I'll be discharging you today. I just want to go over some therapeutic things that you can do at home to manage your asthma. Okay.
In Monica's discharge summary, she was given a couple breathing therapies to do at home in hopes to improve asthma symptoms. These breathing therapies will also help to reduce acute exacerbation of her asthma. The first method is called the Buteyko method. This was developed to normalize breathing volume. The technique's objective is to take less air into the lungs using slow breathing and breath holds following exhalation. Monica was also given an incentive spirometer to take home. This device measures the volume of inhaled air into the lungs during inspiration. Using this device properly will allow the lungs to stretch and open the airways. Nurse Kara used the teach-back method to ensure that Monica understood and comprehended how to properly do both breathing therapies. Nurse Kara also advised Monica to follow up with her primary care physician and to also return to the ER if her symptoms got worse.
After looking at Monica's scenario, patient education is crucial. Today we're going to be going over 5 key points. First key point being understanding asthma. What happens when you have an asthma attack? The constrictions of your vessels and the inability to breathe properly. The second would be identifying triggers, making sure you know what your triggers are, such as pollen, dust mites, respiratory infections. Third, being proper use of medications. We have controllers and relievers. Controllers being those you take daily to prevent a respiratory asthma attack. The second being the relievers that provide instant relief. Fourth one being asthma action plan. This you would develop with your PCM. This is an action plan to show you what to do in case you experience an asthma attack, what medications to do, and in case of an emergency, what steps to follow. The fifth being life modifications. It is important that people with asthma not only live a healthier lifestyle, but refrain from smoking or secondhand smoke, as we saw today in Monica's video.